go around different stations, you get given a bit of a preamble of what you've got to speak to this person about. Could be an actor, could be a different scenario, and then it says you can't speak once you've done.
Dentists, I think we sometimes get a bit ahead of ourselves, don't we? We think, some of us have done specialist training, oral surgery, implants, EMAX, like you say, digital smile design, lab, business, scaling business, opening new sites, making mistakes maybe along the way, but learning from them.
Yeah.
And certainly that's something that we can sort of expedite for a lot of new dentists that are coming into our profession and go, I really want to get into this. How can I get into doing implants? How can I get into the digital side, the lab side? We've got all that experience that we maybe only just realized recently. We've done all these things.
Yeah.
Learned it all ourselves, and as I say, learned the good things, the bad things, and made mistakes maybe a long way with small jobs here and there. The point I'm trying to make, I guess, is we've been there, and between us, we've got a couple of decades of experience and all those things. So it's that side of things too, about how we can teach our mentees or our colleagues how to communicate better and make better choices early in their career, so we can all have a good career, because there's plenty of room for us all.
That's 100%. Like you say, there's always enough people to go around. There's always that dentist who's on the scene who wants to prove themselves, or the one who's claiming to be the best at the time, whatever it is. But I think everyone can benefit by sharing a bit of knowledge.
Yeah, absolutely.
We've set up the study clubs basically to offer 3 hours worth of free training almost. So we're very lucky because we've just been told that Coles is going to sponsor our first evening, which is lovely. And we're going to be able to teach people how to do injection mold composites, which is it's quite a unique sort of skill set, and obviously allows the lab to be more involved in the design process. So it's something that the patient can see before they're actually coming to the point of actual treatment. You can try the teeth to make sure that they're happy with the shape. Talk about shades of teeth and things like that, and have a bit more communication about the case beforehand. And it actually allows therapists as well as dentists the chance to offer a high-end product. We want to offer that as free as possible.
Yeah.
So obviously getting these sponsors on board was actually a real coup for us, isn't it?
Yeah, it is. Yeah, big time. I think it's looking from obviously I am in dentistry, but looking from the outside as a non-clinician, I kind of pick up a lot of stuff as I'm going along, and I will always sound off people to say, so why would you do that? Why not do freehand as opposed to doing the doing a technique that would involve the lab a bit more? So what would you guys, what's the advantages of doing an injection mold compared to freehand and vice versa?